Is 45 too old for breast augmentation? Absolutely not. I think some of the things that women in their mid to late 40s think about is, my kids are starting to launch from the nest and I've been taking care of everyone and now it's time to take care of me. But then the question comes, is it safe? My family depends on me. Is it safe for me to undergo a breast augmentation? It's absolutely safe. If you're otherwise healthy, the chances of something bad happening under anesthesia is lower than you getting in a car accident, driving to the grocery store and home. So it's very, very safe. I think that from an aesthetic standpoint, you can get a wonderful rejuvenation in your 40s. You can feel more confident, feel good in clothing again, in bathing suits, and just really do something for yourself that makes a difference for your self-esteem. Another thing that women in their 40s often ask about and think about is, how much downtime is there? How am I going to keep taking care of my family and doing the things I need to do? Honestly, a breast augmentation has a short period of time where you're having some discomfort, maybe close to a week, and then after that, for 2 weeks, you're really, really taking it easy with lifting. By 6 weeks, you're pretty much back to regular activity. I ask my patients to really take it easy for 6 weeks because that's how long it takes for the incisions to be sturdy and for the pocket in which the implant is placed to start to have matured. So really a week of downtime. At 2 weeks, you can spin on a bike again, you can take a walk, and 6 weeks of really not doing any upper body activities or lifting. Another key thing to address in your 40s is really what you're looking for. Do you want a natural look? Do you want a fuller look that's not so natural? I think it's really important to communicate with your surgeon and to be on the same page in terms of what does natural mean to you, because that may be totally different to what that natural look means to your surgeon. So really having your goals kind of set and knowing what questions to ask, type of implant, profile of the implant, under the muscle, over the muscle, saline, silicone. I think it's really important to trust your surgeon because when you go in for your evaluation, they're going to measure you and look at the amount of breast tissue that you have and really come up with an assessment. And so although you may go in with set ideas, it's really important to trust your surgeon on what they're recommending. I try really hard to listen to my patients and really know what they want and then change my plan based on their goals so that they will get their desired outcome. Lastly, I think that if you're afraid to do something for yourself, if you're thinking you shouldn't do this because you're too old, it's just not true. I've taken care of many, many, many 40-year-old patients who have just been thrilled with their results after a breast augmentation. So listen to my next video to learn how do you know when you need a breast augmentation versus a lift versus a breast augmentation and a lift.